Hey folks, Rose here with some updates from healthcare bills that had movement this past week. Ashley's away, she'll be back next week. Anyway, let's start with House Bill 34. It got a makeover this past week. It's an example of what we call a gut and amend, where lawmakers take all the language out of a bill, and I mean all of it, and they replace it with something they want more. This happens a lot near the end of the legislative session, when stuff can get pretty woolly. Anyway, House Bill 34 was originally a bill to increase penalties for mail fraud. Now it's a bill to make Medicaid penalties tougher on folks who commit fraud in the program. It was inspired by recent revelations about potential fraud around some autism therapy programs that were billing a lot to the state. Anyway, it passed Senate Health and is headed to the Senate Judiciary. Because it had a lot of changes from the version passed by the House, it'll need agreement from that chamber to get to Governor Josh Stein's desk, maybe later this summer. House Bill 1104 is one we've been following closely all session. It's a bill to improve the process of involuntarily committing someone who's in mental health crisis. While it wasn't a gut and amend like House 34, nonetheless, it's gone from being a 2-page bill to a 17-pager. It would expand the telehealth evaluations, improve coordination between courts, hospitals, and law enforcement, increase psychiatric treatment capacity, and strengthen assisted outpatient treatment for people with serious mental illness. The bill comes after the passage of Arena's Law, which was passed last fall. Arena's Law expanded how and where criminal defendants must receive involuntary commitment evaluations. It was well intended, but the new law has prompted concerns about the state's already strained mental health system and the jail system. The mental health system already has too few beds and staff and needs better coordination to handle the increased demand. This one's headed to Senate Judiciary, so it goes here. Finally, Senate Bill 280, the Dominique Moody Act, creates a state child welfare escalation team to assist with high-risk abuse and neglect cases. That's another gut and amend bill that originally started out as a bill to enhance safety at private schools. It got converted after the death of Dominique Moody in Mecklenburg County, and that death raised serious concerns about the state of the child welfare system there. It's the third update of the bill in its current form and would require more documentation during Child Protective Services investigations, expand training for social workers, and increase public reporting and oversight of child safety in county departments of social services. It passed the House unanimously, but because it changed the Senate bill from its old form, it'll require a compromise committee and another Senate vote before it could see the governor's desk. So it came from the House floor and is going to the Senate. Anyway, this is some of what happened last week. It was pretty busy. We're going to have another video from Sky, our intern, and I'll probably do another one over the weekend. As always, like and subscribe, and you can check out the links in the bio.